Why do you think mindset is the missing piece for so many people trying to get healthy?
You have to want it. And that is really where the mindset starts. And I often tell people, do you want the last 10 years of your life to be miserable, or do you want to be in front of this? So if you have that dedicated mindset to doing the things that need to happen to keep you on the path to wellness, then you're already halfway there, because you know that you need to adjust some things.
Welcome back to the Primal Reset Podcast. Today, we're joined by James Keppel, the founder and CEO of Sarana Health, a company pioneering lab-driven, personalized wellness programs. With a background and a deep passion for root-caused health, James is helping redefine what it means to truly feel good in today's world. James, it is a pleasure to have you. Welcome to the show.
Great. Thanks for having me, and welcome from Colorado.
So, James, walk me through real quick. How did you first get into the world of wellness, and what's keeping you passionate about it?
Wow, that's a good question to start off with. What got me in? Totally by accident, actually. And I always preface things by saying I am not a doctor, so that's not my part. I'm in the business part of the healthcare business. So let's see, the way I got my start is I used to run a design firm in San Francisco for over 20 years, and I was hired by a doctor to do a branding program for him. And part of the way that I would approach branding programs was I had to be a patient, basically. So I got to understand his process and how they looked at things. It was a point in my life where I'd never really taken my healthcare seriously. And I just really got into it and was really fascinated by the approach. And I started to look at how are there better ways to do things. So fast forward, decided years later to start Sarana Health. And that was caused by a personal health issue that I had. I needed a liver transplant. And I didn't like the way I was being treated, basically. I felt like a number on a spreadsheet. I felt like nobody cared. And I felt like the treatment, there had to be a better way. So I started to really, learn about how this could work. And from a customer-centric side, it was fairly easy. It's like, spend some time with me, ask me some questions, get to know who I am, maybe instead of just running in and running out of the appointment. And so anyway, I went through my issues and was just monitoring the whole time and basically designed the Sarana Health program around the way that I wanted to be treated. And that really is the genesis of the company. And now 4 years in, we work very hard on that experience side of the healthcare and getting to know who the people are and building a relationship with them. And that's, I think, been the secret to where we're at right now.
And I've experienced it firsthand, what you guys are doing on the personalization and being able to really connect with each and every single prospect client or someone who's just ready to start on their health journey. You've done a phenomenal job at that. I had a great experience with you guys. Would you say that the biggest fault in our current medical system is that client experience and that lack of?
Well, I could go on all day long about the faults of the healthcare system, but I'll try and keep this succinct. Yeah, the personalization is not there. That's the bottom line. We've all been through it where the doctor runs in, maybe he looked at your chart, maybe he didn't, spends a couple of minutes with you. The health insurance industry has guidelines for how long a doctor is supposed to be in the room with you, and they're startling. And it's supposed to be, last I heard, was 10.6 minutes. And 10 minutes. Hi, how are you? How are you feeling? What's wrong? Come back and see me in 6 months, or here's a pill or whatever. So I think that lack of connection to the patient is a major part of it. There's the financial side. There's the PBMs, pharmacy benefit managers, who are basically deciding what prescriptions you can get. And there's a pharmaceutical industry who wants you to take prescriptions. And we just think that there's a better way. If you look at some of the foundations that we based our care program around, has nothing to do with pharmaceuticals. It's the last resort, as far as I'm concerned, that and surgery. But so I often speak in front of groups and I'll say, okay, everybody raise their hand. Everybody loves their healthcare system. Nobody raises their hand. It's like people despise the healthcare system in a lot of cases. And in my case, I was getting no answers. And I went on the Sarana Health program and my liver function improved by 40%, which was completely unheard of. And we did it through nutrition, supplementation, that sort of thing, and lifestyle and behavior changes, and also some medication that was required. But I got to a point where I didn't need the transplant. And, it's totally manageable 5 years later. I guess it is now 6 years later. So, you could poke holes all day long in what's going on, but we're here to move things forward.
And moving things forward with new technologies, do you think that technology is helping or is hurting our ability to feel good?
Yes and no. On the yes side, to start with the positives, we'll take something as simple as phlebotomy. Okay. We use a technology platform to roll out our phlebotomists and schedule them and make it an easy experience. So you don't have to go to the lab. They come to you, and we don't charge extra for that. It's just part of the program. So the technology on the operational side is great. On the care side, I think that we're going down this road of AI being the solution, and I just don't see it yet. I hope we get there. But AI as a diagnostic tool, we do not do that. We use AI for back-end systems, but we do not use it as anything to tell us what to do with a client, because the computer doesn't know who you are, hasn't had a conversation with you like we have. So that's where I see things going. Obviously, you want it to progress. You want it to get better. And the only way it gets better is to fail in a lot of cases. Let it go, but don't expect that that's the solution today. It might be the solution in 5 years. It might be a better solution in 10 years. But are we ever going to get to this idea of, you walk in, the AI tells you what to do and you're better? I don't see it.
So to that point of having AI, and it's definitely not the solution right now in 2025 for that personalization quite yet. How are you able to blend new tools with technology into holistic health habits?
I can't say that there's any one technology that we use that does anything for the patient other than make it convenient. And operationally, it's great, obviously. I mean, we're talking right now because of technology, right? So I think that there's really a fine line between when you count on the technology to do things that it can't do and actually delivering results. Technology, when it comes to the lab results, it's great. We're worlds apart from where we were even 5 or 10 years ago. But caring for a patient comes down to talking to them and understanding who they are and working the treatment or the program around who they are, not trying to jam them into the program because you've decided how they're going to get better. That doesn't work.
I mean, I've spoken with many people on this podcast, and there is definitely a uprising trend and an uprising usability with new technology, and that's what has allowed us to really unlock the holistic side of things and curing ourselves and even just getting us on a health journey to feel better. There's definitely in the way that I've seen it of, before technology was super, super big and part of every single person's lives, when we were reading newspapers in the morning as opposed to looking at our phones and going just from that into high into technology. I mean, every single aspect of our life is technology, especially with all the health metrics and the health tools that we have. I mean, everyone wearing a Whoop band or an Apple Watch or a ring to go to bed and track your sleep. And then you're sleeping on a Tempur-Pedic that can, recline and incline as well. I mean, everything that we have is technology. Are we seeing it more going into, when we talk about personalization, are we seeing everything go almost a little bit backwards into more of a human to human connection as opposed to going further technologically?
I'd like to say that's the trend, and that's what we do. The type of care that we practice goes back to the early 1900s, basically. And it was very much that one-on-one, and you didn't have the technology. You had to just kind of figure it out. So care, I think, is based on knowledge, experience, and judgment. And that comes from people. So, when you blend that in with the technology, it's great. There are plenty of examples of where the technology moves us much farther. And, I don't want to get into an argument with anybody about the lack of or the failures of technology in healthcare because I don't know enough about it. But, we're a client-centered company. And all I care about is, was your experience great? And did we deliver measurable results? And measurable results, that's where it becomes, are the results subjective or objective? Okay. Subjective is I feel great. I feel better, whatever. But objective is measurable results from the tests, the lab tests. So take something as silly as your protein levels. You can say, okay, well, you come in, your protein level's at a 5. And I'm not using real numbers here, but say it's at a 5. And through discussion and understanding your lifestyle and all that, and looking at all the causative elements to what's going on for you, then we can say, okay, your protein level needs to be at a 10. So now we say, okay, how are we going to do that? And could be protein powder. It's always a change in diet, always. And not radical changes, but just minor adjustments in thinking about things. And then we say, okay, you come back, next test, you're at an 8. Great, let's get to 10. It's an iterative process. And I think that just the way that society works right now, it's based on, I want results today. And wellness is not about today. Wellness is about iterative process of constantly improving, constantly reading the levels. And that's where the technology helps us because we can take the data that your Apple Watch gathers. We can take the data from your Oura Ring and we can do something with it. What the Apple Watch and the Oura Ring can do is they can say, yeah, you need to sleep more, but we all need to sleep more. But that's not a treatment program. It's just advice. So what we would do in that case, we'd take the data from your Apple Watch, we'd look at it, we might give you our own wearable, and we've got relationships with companies that do these types of things. We gather the data, and then we say, okay, now we see what's really going on, and here's the way that we're going to attack it. And it's not going to be a pill, and it's not going to be a shot. It's going to be a change in something else, because when you take all the body systems and you look at how they all affect each other, that's the important thing. And I always say that we're detectives. That's it. We have to find what is causing the problem, not treating the problem.
I definitely agree. We got to be more detectives and more into the thought of this is longevity, right? This is for our lifetime and for however long that might be. And this is a process that we need to go through, not the end step. With that being said, what, in your opinion, is the missing piece for people even just starting to get healthy?
This goes to mindset, I guess is the way to put it.
Why do you think mindset is the missing piece for so many people trying to get healthy?
You have to want it. And that is really where the mindset starts. And I often tell people, do you want the last 10 years of your life to be miserable, or do you want to be in front of this? So if you have that dedicated mindset to doing the things that need to happen to keep you on the path to wellness, optimal wellness, then you're already halfway there, because you know that you need to adjust some things. And we don't ever preach wholesale change. It's like if you come to me and you say, I love pasta, okay, the last thing I'm going to do is tell you, don't eat any pasta, right? That's pointless. So what we would do then is just focusing on nutrition for a second, we would balance the amount of pasta that you're taking in with something else, because there's something else missing by only eating pasta. See, it's a balancing act. And that's where, when you look at a truly integrated health program, it's about how does one thing affect the other. In my personal case, liver controls somewhere around 500 body functions, or is involved in 500 body functions. So now you got 500 things you got to figure out, right? That's where the detective work comes in. I could again do an hour on acceptable ranges and why those are nonsense. But if you just go in, you get your tests and the acceptable ranges come back and you're in the green, everything's great, right? Well, probably not, because this one over here is in the red. Now you can say, okay, we're going to attack the one in the red, but maybe attacking the one in the green helps get the red to green. So it's constant analysis from the client side. As I said, we don't preach wholesale changes, but when you go to the grocery store, I want you to read the labels, because taking in 2,500 milligrams of of sodium in your chili that you love, probably not a good idea, right? So don't buy that chili. Buy the low sodium one, and low sodium in the stores is kind of a freaky thing. You got to know what the numbers are. So I'm the jackass in the grocery aisles who's reading everything, which takes why it takes me so damn long. But just that awareness is really key to the mindset. So if your mindset is, I'm going to be aware of what I'm doing, you're again farther along than any legacy healthcare system is going to ever deliver for you. I shouldn't say, but most, let's say.
Could not agree more on that. And I'm definitely one of those people as well, walking in the grocery store. And it used to be, I think, 20 minutes, I'd be in and out with, a week's worth of groceries. And now it's an hour of looking at all the ingredients. Well, not anymore. It used to be an hour of me just looking at everything and figuring out what ingredients are in what and trying to eat as healthy as possible. And, we could talk for days for how messed up our food system is in the United States, but that's for another time.
It's a train wreck.
But I love not to go deep onto kind of those ranges that were given and the BMI index or anything like that. It's funny actually. I used to be looking at that all the time, being an athlete and kind of trying to stay in a certain range. Now we have a quite of a different BMI index when you're an athlete. I mean, I was 6'3", 220, I think, and I was classified as way overweight for my height and my age, which is funny because, I was an athlete. I was a peak athlete at the time. So there wasn't really like yes, that range is supposed to be what we should stay in between, but everyone's body is different depending on what you're doing. If you're in an office environment, probably shouldn't be 225 or 220 being 6'3", 6'3". Probably stay a little bit less of weight, but if you're high in exercise or if you're an athlete of some sorts or whatever your lifestyle is like, there's definitely those changes between all of it.
You hit directly on the why a personalized program is what you need. You can read Dr. Google all day long, but Dr. Google has no idea who you are. Now, if you came in as an example, and we know you're an athlete, you're on a totally different program. And I consider myself to be in fairly good shape, but I'm not at the gym every day. So it's a different program for me. But then you get another person who never gets any physical exercise, and then that's a different program for them. So you've got to figure out all these parts, and it starts in the mind. It's like, okay, I'm committed to doing this, and here are the things that I'm thinking about. Here are my checkpoints every day. Here are the things that I need to be focused on when I'm in the grocery store or whatever. And that comes from that one-on-one connection, because we know who you are, you know who we are, and hopefully the relationship is what solidifies the approach.
So what would you say is one part of your client or customer experience that makes people stop and go, whoa, like I've never heard that one before?
I'm sure that I've never heard that one before moments, but overall, I think the thing that I hear more than anything is, wow, you actually asked me some questions and you talk to me. Again, I could go an hour on social media and all that stuff and the depersonalization of everything. But what we hear over and over and over again is that nobody's ever asked me that question before. And nobody's ever spent the time that you've spent with us. Our intakes are an hour and a half. And with that, you get your physician, you get your health coach and your nutrition coach for an hour and a half. Tell me anywhere that happens.
It's honestly sad to see that there's so few, such as yourself and Sarana Health, like that are actually doing that. It's sad to see that that's not the staple in today's society, and that's not the staple that it should always have been.
And one thing I'm happy to see is that everybody's realizing that this unattachment from dealing with people and talking to people and whoever makes a phone call anymore, right? All that stuff is kind of out the window. But what I'm seeing societally and certainly in healthcare for us, at least, is this move toward let's get back to what it used to be like. So I used to get ripped when we started the company early on to everybody's saying, well, you have to promote this as new. Okay. So what I now say is we've got a new approach to old science. Okay.
New old. It's the new old.
Right. Well, endocrinology has been around for about 3,000 years. Okay. Are you going to argue with 3,000 years of data research, experimentation, results, all that kind of stuff? You can't. But so why do we look at that and say, well, whatever, if you want to be the new company that everything is new, then you would reinvent endocrinology. Why do that? When I grew up, I'll date myself here, but you went to the doctor and an hour's long appointment with a doctor or whatever it was, time frame wise, you spent an hour with the doctor and, it's like, hit you on the knee with the rubber hammer and put the stethoscope on you and all that kind of stuff. And I just got to think that that's better. And we've built the company around that.
And the personalization is really what makes you guys stand apart from so many other of the, I'm just going to help you fix today. If I have a headache, and this is probably the biggest one that we see in the younger generation as well, with going out to bars or clubs and drinking and just even having a quick hangover. Well, I have a headache, I'm going to take an aspirin. I'm going to take, an Advil or an ibuprofen or something to clear my head. It's like, oh, like that's not actually helping you. You might think it's helping you. And the biggest, and this is my opinion, but the biggest thing for me is the reason why you're feeling better is because you think it will make you feel better.
Yes,
And
absolutely.
that's kind of touching on the point with what I asked earlier about mindset. I mean, mindset is you're not ever going to get healthy. You're not ever going to achieve whatever success that looks like for every individual out there if you're not willing to actually do it. And starting with health is your success is being healthy, feeling good, whatever it might look like, losing weight, gaining muscle, whatever it might look like for you. If you're not in the, I want to do this, I need to do this for myself, for my family, for the rest of my life that I haven't even lived yet, it'll never end up working. We could talk to each other all day long and it'll never end up working as
Just
much as
keep
we can
recording
help.
it. Yeah. Yeah. And you hit on a really important thing to think about is, we of course do the market studies and we have when I started the company, I had a predetermined notion about the age range that would be interested in the product. We're finding that age range is skewing down. People are getting on top of this younger and younger and younger. And I am so happy about that because, it's kind of like if you go into a company as a business consultant, say, and you've got a bunch of people in there for 30 years and you tell them, here are all the things you're going to change. Well, forget it. You bring in a bunch of new people, they don't know a different way. And you just, you kind of grow your own clients in a certain way. And I'm very happy that we are skewing younger because it shows an awareness level that doesn't exist in a lot of parts of the country and doesn't exist in a lot of parts of society. And I want to do everything that we can to promote that.
So where can people find more information about Sarana Health and about yourself as well? What's the website? What's the social media links that people can create more awareness and actually start to gain more information and start to understand what they need to do for their own health journey?
Well, we spent 4 months designing our website, and it wasn't about design, it was about content. So I would strongly recommend that everybody goes there. Sarana.health is the domain. I'm easy to find on LinkedIn. Also, my direct email is james@sarana.health if anybody wants to get in touch directly. And what I would really, really encourage people to do is we offer a 30-minute health talk with our health coaches, and it's not a sales call. That is absolute. I tell everybody this is not sales, okay? Because I test the competition, and I'll go and I'll do one of those, and it's like you get 2 minutes. If they say it's a 15-minute call, which is nonsense to start off with, but you get 2 minutes of talking about your health, and you get 13 minutes of marketing. So our health talks are. You can schedule one through the website. Very easily. I encourage everybody to do that. It's free. It's 30 minutes out of your life. We ask you to fill out some preliminary information, but it's not like the 20-page document asking if you broke your leg when you were 6 years old or something like that. It's, I think we have like a 10-minute, 15-minute intake form that we ask you to sign that or send that in so that we're ready for you when you do that health talk. But that's really the key. I'll stand by the fact that I've never had anybody complain about a health talk ever. And I've also never had anybody quit because they didn't like the health talk. So, and one last point on the personalization, when you sign up for that health talk, you're talking to one of our board certified health coaches, and that person is your coach if you continue with the program. So you don't get this passed off thing. Your health coach is your quarterback, and they are with you from the first time you call throughout your entire experience with us.
Awesome. And I'll have all those links in the description below. I've went through it. Everyone go get that free 30 minutes and really just start gathering more information for what your goals are and seeing if Sarana is the right help for you. Go take a look at their website, look at all their information, schedule a call. Like James said, it's the person you speak with first will be there the entire time. This will not be passed off. This is hyper personalization. Highly recommended as well. James, it was a pleasure having you on the podcast today. We'll definitely have to do this again in the future. There's a bunch of different topics we could talk about.